So just tell me who you are. Welcome and thank you for coming in and tell me a little bit about what you do. Tell the audience about what you do, who you are and everything. So,
Sure. Okay. My name is Dr. Vita Bland, and I am a family doctor who is also a hypertension specialist. But I also do a lot of wellness stuff also because I don't think you can really do what I do without, you know, doing that also. I think it's all connected. I really do. So I've been in practice for 50 million years, prehistoric. Uh, but I still love it and I will continue to do it. So, I just enjoy what I do and I hope you'll coming to see me.
so tell me a little bit about your story. How did you get into medicine? What's your story? Because you're not prehistoric. Like you're amazing. I just met you and I'm like, my goodness. Just tell me a little bit about yourself.
Okay, well, to be perfectly honest, I went to college and initially I had a major of math and I thought I was going to be a mathematician. My mom got ill and then I thought, wow, well, maybe I should be a lab technician, running the tests or something like that. Okay, and at the school I went to, I'm a graduate of Bennett College in Greensboro, North Carolina. Uh, you had to do 4 years there, then 2 years. You had to go to do 2 more years to run the labs. And I said, wait. So if I put 2 more years in them, I can order the labs. So so that's kind of how it's like. This is not practical, you know. This is
Oh
how I kind of got to it.
no.
Since you asked.
Hey, no, I want okay, I like that. Wow. Hey.
And I'm glad I did that because I think that I would have been frustrated running the laps. I really, feel that this is where I'm supposed to be.
Right. Wow. So tell me how you became the hypertension specialist. What was your journey to that space?
Well, it's really interesting. I always went to there used to be, back at an organization called ISHIP, which was the International Society of Hypertension in Blacks. And it was a organization that was not just for black physicians. Physicians of any color or creed could be part of it, and I became part of that. And in that space they started looking at getting a specialty in hypertension. Well, I have a lot of patients. I'm in the South. I'm in Greensboro, North Carolina. Okay, so I'm in the South, and I have a lot of patients who present with hypertension, diabetes, high cholesterol, but hypertension is really a big deal. And I had the privilege when I did my residency to work up under Dr. Elijah Saunders. And for those people who know or knew Dr. Elijah Saunders, he was the first person I should, of color who really looked at hypertension in African Americans and how we could help African Americans by decreasing the strokes and things of that nature. And even after I, finished my residency program, I kept in contact and, through ISHIP and stuff like that. And so I decided after that hey, I'm going to go ahead and get my specialty board. So I did my specialty board. I was blessed enough to pass it. And so, I've been doing it since then. And I really think for me, as a calling, is what I was really supposed to be doing, helping people to get their blood pressure down,
Right.
decreasing the sequelae that comes with having high blood pressure and stuff like that. So that's kind of how I got into it.
Okay. So talk to me a little bit about like hypertension. So I know that there's some magic in there. There's some reason that you are the hypertension specialist, right? And so you just said some things and I'm like, oh my gosh, it piqued my interest.
Mhm. Yeah.
And so, if a client comes into you, does a client or a patient, um, do they seek you out because another doctor, are they already your patient, or how do they seek you out? Or, what are some things? So if somebody comes to you and says,
Sure.
I say,
Mhm, mhm.
hey, I have hypertension, or, and I
Yeah.
want to get
Mhm,
it down. What's your
mhm.
approach? Because I
Yeah.
know for me as a
Mhm,
therapist, approach is for me, I don't just look at the individual. I look at like everything they're a part of, their family
mhm,
system, and what is
mhm.
their stress? What is their family system's themes in terms of every generation? What are some of the influences? So, how
Yeah.
do you approach your patient that comes in with that? What
Mhm,
does it look
mhm. Okay, so, some people are just in my practice who end up having hypertension, but there are a significant amount of patients who really seek me out because uh, I am a hypertension specialist. Their blood pressures have been elevated and they've not been able to get them down.
right,
So, when they come in, I look at the whole person because it's yeah, there are genetic issues that come with it, but it also has to do with how people live their lives. I am a very firm believer that genetics a lot of times can put the bullet in the gun, but how you live your life, and what I mean by how you live your life, I mean what you eat, how you sleep, how you deal with stress, that those are the things that actually pull the trigger.
right,
And so we got to look at the whole thing and see where people are. And in looking at that, you're going to find people who come at different stages. Some people are ready to make those changes. They're ready to look at what they're eating. They're ready to make those changes. There are going to be a certain number of them that, hey, you mean you want me to give up my fried? Yes, I want you to give up that fried chicken or cut it back. You can't have it every day, or stuff like that. You want me to stop that? Yes, no salt. I want that salt cut back. But what I also try to do, which I think helps, is, and again, the person is okay. I try to help them understand why that's important. I'm not just asking them to do something. I try to give them the reasoning behind why we want to get those numbers down
right,
and why that particular behavior is affecting it.
right,
We know that, people whose blood pressure is over 130, that, they have a higher incidence of having Alzheimer's and, cardiovascular problems, things of that nature.
right,
So I try to tell people that this is the reason we want to get you down. We have a joke in our office. We have a group of people, we call ourselves the 114 Club, which means that we're trying to live to be 114. Okay.
oh,
So my deal is, okay, now if you want to be in the 114 Club, there's certain things you got to do, and not everybody wants to be in the 114 Club,
right,
but for those, they're going to be certain things that they're going to need to do. But again, it's really getting people to take ownership. Yeah, mama had high blood pressure, daddy had high blood pressure, so did grandma. And yeah, you got some genes here, but let's look at your genetic structure, but also let's look at how you're living your life and what changes we can make with you to help things get better.
right. I like that. I like the 114. Huh. I like that. So give me one thing or two things that somebody has to do to be in the 114 club, the 114. What's that look
First
like?
of all, just express an interest that you really want to be in the 114 Club, okay? And the other thing is, we really try to get people to understand that you are what you eat, okay? And it's really, really important that you look at the quality of the food that you put in your mouth.
Right,
And, preservatives and additives and all those things like that. Those are the things that we need you to make as a rarity. I'm not telling you to give up everything, I'm not telling you to give up all the sugar, and all of that. Tell somebody, for people who are in this area, they know Maxi B's. It's a dessertery, and I go to Maxi B's at least once every 8 weeks. I get me a piece of
right,
carrot cake. So I believe in treats, but it's not something that you should have all the time because we know what it does to you.
right.
So That's that's the first thing that you got to look at what you eat. And the other thing that I think is really most important is, one of the things that we know that really affects longevity is the sleep that you get, the quality of the sleep that you get. So, I try to get people to look at sleep, getting adequate sleep. It sometimes becomes a badge of honor for some people to talk about how they only get 4 hours of sleep a night and how well they do and everything like that. And I try to get them to understand that, that's that should not be the routine, that
Right.
your body doesn't do well when it's only getting 4 hours of sleep. We need to get, the 7 to 8 hours of sleep and good sleep all the time. And, sleep hygiene, things that you can do to make sure your sleep is okay. Watching your caffeine and your, intake. Yeah, if you take a nap, you're not going to sleep that night, maybe, so, just things like that. And I, try to get people to do a routine, like when your kids are little and you give them a bath and read them a story and, they're squirming. They don't want to go to bed because they know that that's happening. But I try to get people to do the same thing with themselves. I do that with myself. I go up, I wash my face, brush my teeth, turn the lights down and try to get myself to the point that, hey, girlfriend, you're getting ready to go to bed, so it's a routine that's important.
Right. Yeah. No, it's interesting you say that because when I think about sleep, even in my profession, right, to get
Mhm,
my clients to sleep, it's important because when somebody's doing even a mental health evaluation, like a mental health check, they ask like,
mhm,
"Where's your sleep been? How are you sleeping?" And so if one's not getting sleep, it can mimic so much that it, people don't understand the power of sleep and breath, right? If
they
you're not
don't.
breathing correctly, like where does your body, the autonomic nervous system, where does your body go, right? And if you're not
Mhm,
getting,
mhm.
then how is your body gonna know to work appropriately? So,
Exactly.
I'm
Mhm,
I it just gives me goosebumps to hear of like, hey, look, you need to get a sleep routine, and now because
mhm,
there's a big population that's still working from home,
mhm.
I've done some research around the lighting of before
Ah,
you,
yes.
before, as you're
Mhm,
getting ready to go to bed, there's a certain type of light that you need to help you transition.
mhm,
And even like being on your phone, now the phones, I know on iPhones, they have where you can change the lighting after a certain, you can change the lighting so it impacts your
mhm.
eyes. And a lot of people don't understand the impact, the power and what comes through your eyes, you know?
You're so right. You're
Yeah.
so right. I've invested in those blue blocker, glasses and things like that that I use in the, evening time. And I have some amber lights that I have, in the bedroom at night instead of
Right.
having the bright lights,
Yeah.
those kind of things. That's part of my transitioning, getting ready to go to bed.
Yeah. So have you seen one of your clients or client patients, I keep on calling clients because I
Mhm.
get sleep and their numbers go down, like they reported, hey, I've been getting sleep. And have they been able, how do they feel when your patients are able to start making changes? How do they feel when they're able to see their numbers go down for their
Well, they feel great. First of all, they're getting enough rest. And you feel better when you're getting enough sleep. You can think better
right,
when you're getting enough sleep. And I think people are shocked sometimes to see how much better they feel when they're getting adequate sleep.
right,
It's amazing that I think, like I say, so many people are so stressed out and that's another thing, dealing with stress in a meaningful way also, getting people to understand how important all those things are to their longevity and to their happiness. I try to get people, I ask them, how you doing?
mhm,
Are you happy? It's like, are you happy? Yeah. Are you happy? That's important, not just, there, but I think happiness is important also. And all of these things I think help people to be happy.
right. Yeah. No, you know what's so amazing is that I think sometimes people look at doctors, it's just like the way they used to look at teachers. So I used to teach fifth and sixth grade. And so
Mhm.
it's almost, I don't know if you remember this. My mom used to be a teacher, but when you would see a teacher out in the community, like, oh, they're they're normal people too. But I'm
Mhm.
wondering how many people get to really know their doctor. And that's something is to hear, hey, you have your sleep routine. Like you're not telling your patients to do something that you're not doing, that
Yeah.
you're not paying it's you're not living you're living what you're asking them to do, right? And so the 114 club, when I think about that, is what are some of the things that you're doing? So you already talked about your sleep routine, but when we were talking before, you talked about meditation. And how does that
Mhm.
help you with your stress level? How does that what is that like for you in doing your
Well, yeah, I'll be honest with you, that is a must. It's like one of my non-negotiables almost. I'm sorry, I'll be late for the office, but I will get my meditation done. It's the first thing that I do in the morning because if I don't do it first thing in the morning, unfortunately, I don't get it done. So basically, I roll out of bed and go straight to the chair to do my meditation.
right?
Uh, and then I go ahead and start my day. I have to be. I've got a dog and a cat, and we got to cuddle for about 5 minutes. They like that, and I find it's also helpful for me. I like cuddling them for a few minutes also, and then we get going. So it was really interesting. I learned to do meditation when I was in medical school. Okay, and it we had some guys who were kind of um back in those days, they were kind of out there, as you say, and they were into meditation and stuff like that. And back in those days, you when you listen to my phone, when you leave me a message on my phone, I always have this um poem or something there
Right.
about living life and stuff like that. So it kind of, I guess I was out there a little bit too.
Yeah.
But the main deal was this. They told us, you're going into a stressful area,
Right.
and you're going to need to take good care of yourself. And so I was very, I think, in my opinion, blessed to learn to meditate early in my career. I have to be totally honest, I got away from it. I thought I was too busy to
Yeah.
do it, for a while. I just didn't have time to do it. But then I found out when I didn't do it, I didn't do as well. You know, uh, you know, stuff got on my last nerve, and things didn't roll off my back the way they usually do.
Right.
And I just found out, as I say, for me at this point, it's a non negotiable. I
Right.
have to do that at least once a day, and I start my day off doing it.
That's amazing. No, I think that's amazing. It's important. It's
It's
because what you're doing is grounding yourself before you go do
mhm,
your gift, like your job, what you've been called to do. And so
mhm,
you're actually showing up for yourself before you show up for anybody else. And I think
absolutely.
an important thing in any profession, but for anybody, and I think that's amazing and awesome to hear. So I do have another question. When
Yes, ma'am.
say somebody is fearful of going to their doctor, making their
Mhm.
doctor's appointment, or they're attempting to get a new doctor, what would be some one or two things that you would advise them on, or helping them make a choice of who they want to seek out, or like inner questions they may ask a provider? What would be some tips for them?
Okay. I think some of the major tips is you may talk to some people who have seen that person. If maybe somebody you were interested in, and you may find some, you may heard something about them, and just see what that person is like. Because I always tell people I'm an acquired taste. I'm not everybody's cup of tea. Uh, so see if that person fits with you. You know what I mean? I think you have to ask. You know, if somebody wants to come in and they don't want to just talk, I like to know what's going on with my patients. I want to know what's going on. you know um I need to know if grandma's sick. I need to know if your baby's sick, because all that stuff also affects you, and it affects what I can do for you. So knowing the whole picture is important. And I never forget, I had this patient who came in, and I asked him about his family history, and he wouldn't tell me about it. Okay. And so he came back for the next visit and he told me, he says, my mama told me I better tell you everything because he didn't understand how important it, I think he thought I was just being nosy, but I don't think he got that it was important about, what has happened to the family,
Right.
and how that affects you in so many different ways. I mean, your genetics and everything, how that affects you. But he did get it, and he came back and he spilled everything. He told me more than I really want to know. But I think you got to find if that person approaches medicine in a way that you feel is good for you. Do you relate to that person?
Right.
The majority of my patients, we kind of relate.
Okay.
We have this thing. They know that my aim, as I tell them, is to keep them here as long as we possibly can and as healthy as they possibly can be. That is my goal. That is my job, to keep you here as long as we possibly can and as healthy as you possibly can be. So if we both have that same goal, then I think we can make it. But if your goal is, I really don't want to take this medicine, I really don't want to do this, my mama made me come in here or my girlfriend made me come in here, we may not be able to make it work because you're not invested in this.
Right.
You're here only under duress.
Man, that's powerful with it. Like you gave me like goosebumps because what you're saying is this is my goal, this is my aim, and this is what I'm here to help you with. There's a lot of people that don't even have an aim when
Hmm.
they're practicing, no matter what space it may be. And there's something that I say particularly with my clients that are seeking psychiatry, right?
Hmm.
I
Hmm.
say,
Hmm.
hey, I need you to go interview that psychiatrist. And but for me, the best psychiatrists that I've worked with and collaborated are the ones that the minute that that client comes in, they're talking about, hey, how can we eventually get you off? And that for me is, hey, how do we, I want you to understand this is a long-term goal, that some maybe this is something that you don't need long term. The medication might be something you don't need long term, but for to get you through something. So it
Hmm.
brings it makes me feel so good to hear about your aim, that I think the people who are listening is when they go and talk to new doctors or somebody that they're thinking about on their wellness team is, what is that person's aim? What is that person's aim when they work with a patient or a client? I think that's big. I love that. Like I want to come and be your patient. Um, because it's really important. It's really important because it puts things in perspective. If you're saying my
It
aim is
does.
for you to be the healthiest and to be here as long as you can, think about that mindset and that intention that you're putting out there for you as a practitioner, as a doctor, but also what you're putting out there for in your work. You've already moved things out of the way because you already created your aim for your patient. I think that's
Mhm.
amazing.
Well, thank you.
Yeah.
But the question is that person there? And you have to also remember, I'm sure you see this all the time, that you got to meet people where they are.
Exactly. Yep.
Sometimes they're not there, and hopefully you can get them to come on, where
Right.
they want to, where you want them to be, and hopefully where they want to be. But I
Exactly.
also respect where they want to be because not everybody has that goal, you
Right.
know.
No. Yeah. It talks about just kind of, are their motivations, are they
Hmm.
the motivator and saying,
Hmm.
hey, I'm going to do this? Are they compliant? It does go into that,
It
where they,
does.
how compliant are they? Or do they feel like, they even have the agency to make those changes and those choices? Um,
Yeah.
yeah,
Yeah, and also I think what happens, you got to make the visit meaningful, and you got to make it a little bit of fun. Like right now, this time of year, I tease my patients and I tell them, I don't want your blood. I don't want to see what your blood is because I know what you've been eating. So we're gonna get your blood in 4 months. Now I'm giving you
I
4 months to get it together, and pull your red wagon in the road. But they think it's funny that I say that, but I'm dead serious. If I get these numbers, I got to do something about them. So I want to know what they've been eating. stuff. I want to give them a little time to try to get it together so that I don't have to start stuff which I maybe should not have, but I what the numbers show me. You know what I
Right.
mean?
Yeah. That's amazing. Is there anything else that, or one thing you would want to give the audience to walk away with? Is there, as summing it up and coming full circle, is there anything that you would want a takeaway from them?
You know, I tell my patients constantly, you are worth it. You are worth it. You are worth eating the right foods. You know, stay away from all the sugars and stuff like that. Give yourself a treat, but your health is worth it and you are worth it. And I need to get people to buy into that they are truly worth it. And when I say worth it, you got to put some work behind it. It's just not going to come. You got to do the right diet. You got to be, get the right sleep. You got to deal with stress in your life. And also when you decide that you are worthy of something, there's just certain mess you just don't allow.
Yeah. Yes.
So getting, people to understand you are worth it, you are worthy of it. Let's go. You know.
Amazing. Where can people find you? Where are you? I know there's some things you got going on. Where can people find you?
Well, I'm in Greensboro, North Carolina. Been here for 50 million years, as I say. So, we've been here for a long time. Um, and that's where I am. I truly enjoy what I do. I'm very blessed to do what I do. And, it's just what I think God has me here for.
Okay. So can you got a radio show, my dear?
Oh, yes, I'm sorry, I forgot. Okay, so we are which you were my latest guest and absolutely fabulous. We have a national radio program. It's called It's a Matter of Your Health, the 30-minute health magazine. We are on the NPR satellite. So a lot of NPR stations will run us. But you can also go to our website, drblandradio.com, and do that, or go to or go to our Facebook page. We also are a syndicated national columnist. And so you can also catch us in a lot of African American papers across the country. Also, I have a syndicated column that runs every week. So you can hear some of my rantings and ravings on some of that also. So we try to be, out in the community. I see it as my job to also help educate people, because a lot of things people just don't know. And if I can get you educated about it, or just maybe start thinking about it, you can go to your own healthcare provider or whoever and start looking at it and seeing if this is appropriate for you.
Right. Well, I want to thank you for coming on. And I know
Absolutely.
I'm going to have you on more because I know
Okay,
there's
sure.
more about hypertension and, and certain things and questions as this wellness hub keeps moving and growing. But
Mhm,
I
mhm.
appreciate it and thank you so much.
Well, thank you for having me. I've enjoyed it.
Yes, yes, yes.